Hi, I'm John Kenlon, the publisher of Drugstore News, reporting from the NACDS Pharmacy and Technology Conference in Boston. One of the biggest challenges facing older consumers today is how to pay for life-saving medication. And while over 39 million seniors are enrolled in some form of Part D coverage to help them pay for their drugs, many seniors still need help. And that's why Astrazeneca has introduced AZ&Me prescription savings for people with Medicare Part D coverage. We're talking with Harvey Maldo, Director of Professional Relations from Astrazeneca. Harvey, who is eligible for AZ&Me?
Patients who are enrolled in Medicare Part D are eligible for Medicare and Me. Any patient who's enrolled in Medicare Part D.
So Harvey, does that mean that all Medicare patients can receive this benefit?
Well, all Medicare patients have the potential for receiving it, but we're targeting indigent patients. So patients have to meet certain criteria. They have to have spent 3% of their annual income on drug costs, and their income for an individual has to be under $30,000 or $40,000 for a family of two.
Harvey, why has AstraZeneca decided to do this?
Well, we want to make sure that our medications are used and available to any patient who needs them. Our philosophy is patient health first. And what's the purpose of making great medications if patients can't afford to take them?
Harvey, tell me, how do patients enroll?
It's actually very easy for patients to enroll. They can actually enroll directly in their pharmacy. They can get on our website, www.azandme.com, or they can call 1-800-AZ&ME. And the initial prescription fill after a short inquiry will be available to them immediately. So there's no delay. The patients will have to verify information, and that'll be done through a mailing to their homes after the initial fill.
How long do patients have to wait before they can get their first prescription filled?
Patients can get their first prescription filled in their local pharmacy almost immediately. All they have to do is call 1-800-AZ&ME, and someone will interview them, and within 10 or 15 minutes, they'll be given an interim number so that they can get that prescription filled that day in their local pharmacy.
And tell me, Harvey, how much do patients have to pay for their medication?
Patients will pay a maximum of $25 for their prescriptions. It can be as little as $15, and it depends on their income level.
And which drugs are covered by the AZ&Me plan?
Most AstraZeneca medications are in fact covered by this plan.
Why not just switch patients to a therapeutically equivalent generic drug?
Well, there aren't always therapeutically equivalent drugs available. That's the first thing. And secondly, it's very important to assure that patients get the medications that they actually need. Sometimes patients have been switched from different drugs and are placed on an individual medication because that's the only one that's effective. And switching them back to drugs that have not been effective can be detrimental to their treatment.
And how does the pharmacist process the claim?
Pharmacist adjudicates this claim just like any other claim. They'll have an ID number for each individual patient, and they can just process it through their normal work stream.
From the NACDS Pharmacy Conference in Boston, he's Harvey Maldo. From AstraZeneca, I'm John Kenlon, publisher of Drugstore News. Thanks for watching.